Nothing is easy, the time that you worry, my friend, it's okay.
Okay. Your treatment options include a bunch of different things. They would range from active surveillance, meaning that we would keep checking your PSA every 3 months, making sure that it doesn't rise all of a sudden, and then repeat a biopsy in a year and a half to see whether or not the prostate cancer has changed. If in the meantime, either by ultrasound, rectal exam, or PSA, you have some kind of change, we might biopsy you earlier. And then if your cancer has gotten worse, it would be a reason to treat you sooner. You're not the ideal surveillance candidate because you have a little bit of element of 3+4s, you've got a little bit of that 4 in there, and you have a relatively higher volume of disease. So one option would be surveillance. The second option would be surgery. We could remove the prostate, and for you, a robotic approach would be a reasonable approach. The old-fashioned way of removing the prostate would make an incision about this long below your belly button, dissect down to the prostate, move the nerves off, get the cancer out, close you up, put the bladder back with the urethra. You're in the hospital maybe 2 days, takes you probably a few weeks to get back up on your feet, and probably a few months before you feel normal. Robotic prostatectomy is a similar surgery, but instead of doing one single incision that's long below the belly button, we do 5 incisions across your belly that are each less than 1 inch long, and use long instruments to dissect the prostate out. They're controlled by a robot, which we control. And then we take the prostate out through one of the incisions that we make a little bit longer to about 1 inch. The difference there is that you're in the hospital for maybe a day as opposed to 2 or 3. You go home, you probably feel knocked out for a week, maybe 2, and you feel kind of back to yourself in maybe 2 months or so. So the recovery is a little faster for you, not by a lot, but a little faster. And probably the other place where it makes a bigger difference is the amount of bleeding. There's generally less bleeding with a robotic surgery, and we're probably a little better at sparing nerves with robotic surgery. And you know, given your history of taking the methotrexate and stuff, you might have some scarring in your abdomen. The likelihood is that if we did it robotically, we'd be able to complete it robotically, but there's always a small chance. Here it's about 2 in 100 or so that we have to convert to an open surgery. We can't complete it robotically for whatever reason, and we do it the old-fashioned way. The last option then is radiation. So for your volume of disease, it's likely that they would do a combination of radiation for you versus just doing external beam radiation. So generally the 2 types of radiation we recommend here are brachytherapy, and they're permanent seeds. We use iodine seeds here that irradiate the prostate. What you do is you come in the morning, you go home in the afternoon, we put you to sleep, we put your legs up in stirrups, and we use needles to go through the skin behind your scrotum to place seeds in the prostate. Those seeds stay there permanently and emit small amounts of radiation over time, which kill the prostate tissue and the cancer. If you had a smaller volume of disease and only 3+3, you'd probably just get brachytherapy. But with a slightly larger volume of disease and an element of 3+4, I'm guessing the radiation oncologist would give you external beam radiation therapy as well. And that's where you have to go to the hospital once a day, every day for somewhere between 5 and 10 weeks. And they put you onto a scanner and they zap you from the outside. And the goal of that is also to kill the prostate cancer. But instead of leaving something permanently in there, you just irradiate it and then you're done with your treatments. But it does require going every day for a period of time. Sometimes they give you a little bit of androgen deprivation therapy, which is either a shot or some pills to suppress the prostate cancer. Prostate cancer is very sensitive to testosterone. So if we give you something that knocks down your testosterone, we find that sometimes the radiation is more effective. They sell you on all the advantages of radiation, no side effects, no urination symptoms, which is true if you only follow people out a couple of years. But if you trace people out 5, 10, 15, 20 years, then you're going to be around that long. You know, the side effects that you get from radiation, when they happen, are terrible, and the treatments are not great. And the radiation folks, they don't see them because when you have problems, you come and see us. So we do the reconstructions, we deal with the side effects. Initially, just from the initial radiation, people feel pretty worn out for a couple months. But I would say that overall, if you just compare the side-by-side recovery in the first year, radiation is probably an easier recovery comparing the two, the 20 years down the line.
Right.
Where, you know, once you have side effects from radiation, the treatment options are not great. We kind of, you know, we kind of are dealing with it to kind of get you through things, but you know, there's nothing easy about it.
Okay.
You're a young guy, though. I'd anticipate that you're going to see those effects further out down the line. For younger people, more aggressive cancer, my bias is to favor surgery. Older people, less aggressive cancer, I think that radiation is probably very reasonable. In your case, it'd be reasonable to choose either one.
Nothing's easy.